Good morning, everyone, and thank you for joining us today. We organized this session because our community has recently been impacted by several tragic heart-related events. In just a short period of time, we lost multiple individuals, and these incidents have raised many questions and concerns among families, friends, and community members. As we reflected on these cases, several common themes emerged. One individual appeared healthy, was not overweight, and remained active, yet had not been undergoing regular health screenings. Another individual was diabetic, taking medication, physically active, and involved in sports, but was also dealing with significant work and life stress. In another case, symptoms were initially mistaken for gas or indigestion. Home remedies were tried, but when the discomfort became severe, emergency services were called. Sadly, the outcome was tragic. And in at another case, lack of regular screening and ongoing work-related stress appeared to be important factors. These experiences raise important questions. Why are heart attacks occurring in people who seem healthy? What role do diabetes, stress, and family history play? How do we distinguish between simple acidity and a potentially life-threatening cardiac event? What screening should we be getting and at what age? And most importantly, what should we do during those first critical minutes when every second counts? Our goal today is not to create fear, but to create awareness through education, prevention, early detection, and timely action, and many heart-related tragedies can potentially be prevented. To help us better understand these issues, we are privileged to have two highly accomplished cardiologists with us today. First, we are honored to welcome Dr. Karanji Reddy, a nationally respected interventional cardiologist with more than 4 decades of experience in cardiovascular medicine. Dr. Reddy has served in numerous leadership roles, including chairman of the cardiology department at Florida Hospital Healthcare System, co-director of Cath Lab, and director of Acute Coronary Syndrome Program. He was also recognized with the prestigious Florida Hospital Values Award, one of only 5 physicians selected from approximately 2,500 physicians for exemplifying excellence, compassion, integrity, and service. Joining him is Dr. Ramakrishna, is an Indian-born British and American-trained cardiologist. His specialization is interventional and structural cardiology. Trained at the University of Pennsylvania, Philadelphia, and Mount Sinai Hospital, New York, both top medical institutions in the country. Deal with heart emergencies with clogged arteries, sudden cardiac death, and is currently Chief of Cardiology Division at Advent Health, Waterman Hospital with office in multiple locations. We are grateful to both physicians for taking the time to share their expertise with our community. So, thank you. Dr. Ramakrishna.
Yes, sir.
Our community has recently experienced several sudden heart-related deaths involving people who appeared healthy, were active, working, exercising, or going about their normal lives. From your decades of experience, why does this happen? What are the most important warning signs, risk factors, and preventive measures that every family should understand? And also, we sometimes hear about people collapsing while exercising, playing sports, workout, or even dancing. Does physical activity trigger these events, or is it exposing an underlying heart condition that had gone undetected? Please go ahead.
Hope all of you can hear me, sir. Can you hear me too, Srinivas?
Yes.
Now, let me put it this way. There's nothing, my slide, I hope you guys are all able to see my slide. Prevention of sudden cardiac death. Every member anywhere in the world dies out of heart disease. You consider heart as the engine, right? When the sudden cardiac death happens, the heart stops. That comes the ending, and you move on. Your family loses you, and you're a dead man or a woman. There is nothing called sudden. Lifestyle, self-assessment, etc. My goal today is to educate all of you to look at few things, self-reflect upon yourself about what's happening to you or to your family members, and get them some help. When you help them, that's when it's gonna help them live better. Okay.
Yeah.
Questions will be answered at the end. Please mute your phones and then please write it down. My goal is to give you a perspective to understand. I'm sure I will be able to educate you all. And Dr. Reddy is also prepared to give you more education. After this lecture, one key factor I want all of you to learn is see your doctor. Look at yourself, see your doctor at least once a year for your annual physical screening. Look at where you are. That usually prevents almost 90% of these sudden events. Second most important thing, as an opening statement from me, is the word is stress and Indians. The numbers the Western culture uses in terms of your cholesterol or blood pressure and everything is different for Indians. You can't just say, my cholesterol is okay. In fact, our cholesterol as an Indian with a South Asian descent should be 20% below the Western numbers. You saying my LDL is this, my cholesterol is this, I'm good, it will not apply to you. You got to look beyond the simple numbers. Let me go ahead with my next slide. My goal today is to educate you all on what are the warning symptoms, what are the risk factors you should look for, how do you prevent this, and what can you do, and you need to get tested. Now, warning symptoms. Almost there is 2/3 of the people who die out of sudden events. When I see them in the hospital where they're collapsed, unconscious, 2/3 of the people did have some symptoms. When they survive, when I talk to them, when they survive after fixing the heart or doing a shock or 50 different things we can do, if they reach to us in time before they're dead, is feeling a sensation of chest pain, which just came on new, feeling a sense of out of breath. This is not normal for me. They know it. Then they decide, oh my God, I hope it's not a heart. I think it is just a gastric. I think it is just a gastritis. Let me walk it off. Let me take something. I have a simple suggestion here. If you feel a chest pain, feeling out of breath, take a walk. Walk from the front door to your mailbox and come back. If it's getting worse, it's not your gastritis. It is not your something silly coming on. It is your heart. Reach out. Number one thing you need to do, tell your family member you're having these symptoms so that they will be around you. If something bad happens, they will help you, or call 911. Number two, just if you don't have any help and if you're in a position of unable to help yourself, just pick the phone, call 911. America has a system to people to reach out to you. If you're collapsing, you can set up on your phone and automate it that the phone drops automatically. If you're not in a situation to answer, your phone calls 911 automatically. Every smartphone has that option. Think of it. Just activate that option. Now, coming to the symptoms yourself. If you're feeling unusual fatigue, a sensation of pounding in your chest on and off, like why a 30-year-old normally walking, doing his work, suddenly feels his heart going out of the norm in the heart and stopping and then going out of the norm. It's feeling something wrong. Sit down, call your family member. If you don't have anybody else, call 911. It's okay to go to urgent care, go to the hospital, get tested. That is more important than dealing with the catastrophic event of losing life. The most key word I want you all to remember, 90%, 80 to 90% out of 10, 8 to 9 people out of 10, if it is a blocked artery, you get an unusual sympathetic response with sweating like sensation. You start feeling a sensation of sweat and you're feeling out of breath and fatigue. Please recognize that symptom. No viral infection, no gastritis, no just simple tummy ache does that. Wherever you are, in whatever situation you are, seek help. Now comes the worst case scenario. You suddenly collapse. That's an active emergency. You're dying. It's an active emergency. Your family member is just falling down. You have a lack of pulse. You're feeling abnormal breathing. You're feeling pale, diaphoretic. If you don't have anybody, you have your phone, just dial 911. Tell them where you are, ask for help, lie down flat, call for your family to help. There's nothing called self CPR, unfortunately. In that situation, you lying flat, your circulation, your brain, which is the most important thing, needs oxygen. When your brain loses oxygen, you die. It's not the heart which pumps. Heart eventually will stop in that situation. When help reaches you, even if you're in a condition of everything stopped, a CPR, what's called as a basic life support course. If you have family members who are elderly, family members with medical problems like diabetes, heart disease, or some other conditions, it's important the family members talk about basic life support. It's important one of them learns about it. It's important you keep some emergency medicines like aspirin, um, things like their inhalers. If they're asthmatic, make sure your inhaler is in a particular spot, a nebulizer. Make sure you have a kit. You have a fire extinguisher at home, make sure you have a medical kit. Ask your doctor, your primary care, what kit you need to have at home. It could be an EpiPen. Nothing wrong. You can say I have diabetes, I have heart disease. Doc, I need an EpiPen. EpiPen is $20. Get it, keep it with you at home. Get a shot. If something serious is happening to your family member, give that EpiPen, call 911 and wait for their help. That is how you save your life. Now, everyone who is listening to me on this phone through this system, please think of yourself at whatever age you are. Is this normal for you? Are you in your good health? What are your health parameters? When did you last see your primary care? When did you reach out to them saying, hey, I need testing. I just want to make sure I'm good. Running a basic EKG, basic blood tests, getting a good screen to your heart murmur, heart muscle. Very simple. Spare 15 minutes of your time for your doctor, at least once a year. Spare 2 hours for yourself. Please think of it. You're getting your car serviced 2 to 3 times a year. Get your body serviced once a year, please. Then comes risk factors. We all worry about what are your risk factors. All of you listening to me, just keywords I'm going to mention. Think of it. Any of your family members, your parents, your grandparents, brothers, sisters, niece, nephews, had any bad heart disease events, sudden deaths, you are at risk. Go get tested. Now, most important things, lifestyle. We all try to live a different life. Smoking, absolutely no. Smoking is directly related to sudden death in the form of heart attack, arrhythmias. Diabetes, this monkey is going to get you. Before it becomes a bear and kills you, make sure you control it. Diabetes can lead to heart disease on its own, so you got to control it. Blood pressure, self-test it, get tested. You walk to Publix, you go to so many Walgreens, they have a self-testing machine. Just test yourself. Where are you? Sit down 10 minutes, get tested. Then get tested for your cholesterol profile. Very easy. Now, most important, now all of you listening to me suddenly don't decide, I want to live a very healthy life and start working on a gym. Please don't do that. Strenuous physical exertion with undiagnosed conditions can lead to sudden death. These are all the WhatsApp videos or Facebook videos you're seeing, people who are doing gym and suddenly collapsing because they have underlying conditions and they're suddenly doing a physical exertion and they die suddenly. What happens in this gym is when they do this heavy weight, it's like a hydraulic. When you're lifting a weight, your heart needs to pump blood at a very high pressure so that it can deliver the oxygen to the muscles to lift it. Then it expands and your aorta ruptures. When it ruptures, you collapse and die. There's no way anybody in the world can save you. Before doing any strenuous physical exertion, stop. Get tested, get cleared, and then do it. Most important factor for all the women in here, especially a woman, and my keywords, women 50 to 60 with a lot of family responsibilities, you go through a lot of stress. We do see on a routine basis in the hospital women with cardiomyopathy where their heart is totally dilated, unable to pump blood. This can lead to sudden death in the form of arrhythmias. Stress, everybody goes through it. I go through it. Srinivas goes through it. Dr. Reddy goes through it. All of us have it. We got to learn to manage it. At to a level, you're going to say, I'm going to give it up. I mean, the funny anecdote is we have heard in India, rishis, sadhus, people who gave up everything. The reason they gave up everything is just because they didn't want to deal with this stress. There are different ways to handle, different education material available. Learn to handle it. Not everyone can become that person. Be you first. Live your life. That's what I want. I don't want this stress. Now let's look at common preventable causes. All of you taking down notes. Coronary artery disease. If you have blockages in the vessels supplying your blood to the heart and they become 90%, 100%, that's an acute heart attack, especially if it's in a critical vessel like in the right side. Sometimes people get fatal arrhythmia. Sometimes you can have a widowmaker at the front of the heart. You can collapse and die. You could be in a situation where you're helpless. A phone with a 911 automatic when you collapse may bring paramedics and bring you to the immediately to us to help save you. But I don't want you to wait for that. Recognize what's happening. Take a walk. Now suddenly you and I say, hey, Dr. Reddy and me want to figure out what's happening with us. We are listening to this lecture. You know what we should do? We should think of myself like, hey, I was doing this 5 years ago. I was unable to do this now. There's something going on. I need to get tested. This is just not deconditioning causing these symptoms. Get tested. Now, the heart rhythm disorders. Some people do have families with heart disease and heart arrhythmias. They can have heart rhythm abnormalities causing arrhythmias and lead to sudden death. Most of the heart rhythms are also related to the blockages in the blood vessels, as I mentioned before. Sometimes you do take some shady supplements. They promise you gold, but no, it's not. It's a fool's gold. You end up, they mix things in these supplements which they don't tell you. They'll say they're coming from plants. Even cocaine comes from a plant. They mix things in these supplements to give you an unusual, happy, lot of energy and vigor, but they're actually damaging your heart quietly, and that can lead to arrhythmias and sudden deaths. Now, look at this adverse effects of common medications. Some of the common medications you do take can cause like a weight loss medication. They can trigger an arrhythmia. Sometimes fentanyl is a weight loss medication, it triggers an arrhythmia. Doesn't lead to heart attack straight away, but it goes indirectly. You're taking a weight loss medicine, you're a big person without knowing you have already disease, and you start doing exercise, they're prone to cause arrhythmias, you're going to get death. Heart muscle disorders, most of them are familiar. When you go see your primary, when he does an EKG or a monitor, he would figure out you have a inherited heart condition. Again, I tell you all, stop, think any of your family members have heart disease. I already mentioned stress in women. Now, well, alcohol. A little alcohol in the past was considered to be health medicine. Now, alcohol in general is considered bad for heart, but I do not see with a little alcohol fatal arrhythmias or fatal heart blockages. But the problem is alcohol in excess. That means people getting drunk at least 2 to 3 times a week, they lead to heart muscle problems and they can get problems. Viral illnesses. This is the one which is uncontrolled. All of us can go through it. When COVID happened, added the level of stress with COVID, people did get bad heart disease. Prevention. Now, forwards. Please do not hit the gym or exercise or diet vigorously immediately. Please don't do that. Stop, learn yourself where you are, how you are. Go ahead, discuss with your doctor, get an annual physical test, and that's when you start working on your way to health. Now, how do you prevent? All of us, including me, we need to live a heart healthy way. We need to have some control on the diet. Animal fat is the bane of our modern society. I tell my patients bacon is poison. Think of this way. Animal fat has a lot of chemicals nowadays, in addition, the way the animal is treated to grow, including chickens and whatever. I tell them egg is probably only the safe animal byproduct in addition to milk, which you can eat with no effect on the heart. Other than that, animal fat, you got to totally control it or limit it to the extent possible. A light exercise is advisable to all of us until we are on this earth, and we all need to learn to manage stress. Of course, no smoking. We all have to control diabetes and blood pressure. If you have it yourself, if family members have it, in them. Get tested, please, especially with family history, heart-related deaths. We do have availability of genetic testing and advanced lipid screening, which will help you recognize if you are at that risk. Check your supplements, check your medications. If any of them can cause it, limit them or control them, recognize them. Please be prepared for your family. Get ready with a basic life support, learn CPR courses, have some emergency kits. This would help you protect yourself. Now, what should you do today to know where you are? Hey, doc, I'm 30. What do you think I am? Simple test. There's a, if you can take a screenshot or take a picture of this is what you need when you see your doctor. Ask for a cardio IQ lipid panel with inflammation. Or it's also available the same test under LabCorp, named differently. The screen will tell you what you need to do. It has tests to recognize at what level you are right now. It also tests your inflammation. Inflammation is a core which leads to all these. You got to check your inflammatory markers in addition to your advanced lipid panel. Advanced lipid panel identifies small dense particles, your current activity in the body, amount of buildup it is causing, so that you can use that as a parameter to get tested. Now, I will share a sample screen. I'll share a screen with you on what else you need to know, what type of testing is available to know how does a sample a blood test like this would look like. Now, this is what it looks like. When they run the test, you'll have all the cholesterol markers. You'll have LDL, which a lot of people look at it. Not just plain LDL. What type of LDL you have? You have small, medium, or large. Or you have what is your ApoB, which is a new risk factor. Your inflammation, your lipoprotein A2 activity. That means they're actively having a plaque right now, which can break. You're trying to board an airplane. You get your blood test. Your PLA2 activity is really high, you can get a heart attack anywhere in the world you are. These tests will identify them early for you. And then you're looking at your insulin resistance, your diabetes risk, then your inflammatory risk. It gives you a pattern of test results to identify where you are. This is a key test which you need to do and do not ignore it. Now, then comes the point, okay, doc, I have this. Now, what do I do? Uh, Sorry, some wrong slide came up. Okay. Now, what do? I have it. Now, you do have a plaque buildup. You do all these markers. Then you got to look at, as I mentioned in the previous slide, you're looking at the particle sizes. We need to identify too many small particles can lead to heart attack faster. Now, you have a low inflammation, high inflammation. Inflammation is a silent risk for your heart attack. That's going to happen. Inflammation leads to aggressive plaque buildup in your blood vessels, not just your heart, to your brain, in your carotid, can lead to a stroke, equally devastating. Now, in these people with high risk, before I tell them, hey, one, you need to control, two, I need to know where you are, a plain stress test may not identify it, especially with Indians who are obese. If you're obese, you're a big body, a stress test may not even identify it. It'll become, or if you have a balanced ischemia, you have two blood vessels, we have a disease, it will not identify it. The modern day testing, there's a recent trial which came from Australia and UK. Just go ahead and get a coronary CTA. And with some contrast, you can, all these tests I talked about, you can pay cash and get them done in healthlabs.com. Or you can go to any imaging center and pay cash and get them. Not just calcium screening, get a coronary CTA. Coronary CTA will also have a calcium screening in it. The coronary CTA, as you see on the image, will identify the tubes of blood vessels supplying your heart. It will also identify any buildup. If you see all that, you know you're going to be aggressive, controlling your risk from there on. Then you're going to time your exercise, test yourself, and protect yourself. Going blindly with a full exercise thinking you're going to be okay is the wrong approach to it. Now, to summarize, we Indians have a higher risk for heart disease. Our target cholesterol numbers are lower. We need to learn from today to manage our risk and our risk factors. It's obvious for all of us. You read all over, stop, look back at yourself, start putting this in place, start working on it. Get tested. They're all available for you, including a CAT scan. Most important, all of us, we need to bring a change in our lifestyle. Let's lead by example at home. You start doing it, you start telling them, and then slowly over a time period within a year, all of us will be safer and have a plan. Now, I'm available all over the internet. Put my name, Advent Health, it all pop up. There's a lot of education available. The care philosophy is to be simple to all of us. We should take care of all of us the way we should. What do I do for a living? I do everything possible to protect the heart. I do open the blockages, do lifestyle changes. There are medicines available now, starting from a cholesterol lowering simple medicine, like at home remedies, to advanced injections to get this risk controlled for you. You can get all these controlled very easily. First, you need to identify where you are. Okay. I would limit my presentation here so that Dr. Reddy can get involved, and then I'll come back with questions. Srinivas, are you there? Thank
Yeah,
you all.
yes,
If you
yes.
all have questions, we will get on
Yeah.
with you here. Okay. Thank you.
Thank you so
I'll be
much,
there.
Dr. Krishna Garu. You did really nailed it. Actually, what we need to do, prevention and screening and precautions, everything you got it covered. So right now, Dr. Karan Reddy Garu, please take over and do your presentation, sir.
Yeah. Hi, everybody. Can you guys hear me?
Yes.
Okay. I think that was an excellent presentation focused on acute condition, how to recognize and how to prevent it. Like they say, it's very hard act. It's very hard to follow a good act. But I'm going to give it a try, Dr. Krishna. So basically, the reason I wanted to just make it a little bit more comprehensive is because these are all interrelated in terms of cardiovascular disease. What is it? What are the symptoms? How do you treat it? How do you prevent it? The acute situation has already been very well addressed by Dr. Ramakrishna. One thing one has to realize that this is a subclinical disease, meaning most of the time you may have it, you may not know it. And what is cardiovascular disease? It includes both the coronary artery disease, which is blocked arteries to the heart, peripheral artery disease, poor circulation to the legs, and cerebrovascular disease, poor circulation to the brain. All of this is basically the same mechanism, meaning the plaque buildup in the arteries to the heart. And the risk factors are the same for all of this. And if you have one disease diagnosed out of these three, that means there's a 30 to 50% chance that you'll have the rest of them too, in some form or the other. So why is cardiovascular disease important? It's the number one killer in the United States compared to any other condition you could see. And about close to 1 million hospitalizations for heart attack in this country. And new heart attack, half of them, it's the new heart attack. And the same thing with strokes, about 500,000. And the cost is enormous. I think it may be close to 1 billion now. This is old data. So what are these symptoms? I think Dr. Ramakrishna went very well over these symptoms. So chest pressure, tightness, heaviness. Sometimes when the doctor may ask you, do you have chest pain? You say no, but they have to be more specific. Do you have any discomfort, tightness, heaviness, or someone sitting on your chest or chest pressure? Because simple chest pain answer, sometimes patient not get it. It could be heartburn, indigestion feeling, pain in the epigastrium, or pain across the shoulders, pain in the back, or the pain radiating or discomfort or numbness radiating to either extremity, more commonly left upper extremity. And you could have shortness of breath or worse with activity, fatigue with exertion. And so these symptoms typically occurs with exertion, relief with rest in 3 to 5 minutes. Sometimes you may be having chest pain a lot of times. After you hear this talk, every chest pain you get, you may wondering, is it be the heart? Typically, the heart pain doesn't last a few seconds, last few minutes. And typically it increases with activity and relief with rest. So keep that in mind. I see a lot of patients with chest pain, which is not related to the heart. That's why I'm bringing it up. And whereas if it's a heart attack pain, it can last for about 15 minutes to 6 hours. Okay. The most important thing, if anything you didn't learn from this talk, is 25% of people who have clogged arteries have no symptoms. And 50% of the patients who present with a heart attack or a sudden death, they have no warning symptom. The first symptom is the heart attack symptom, which they may have failed to recognize, which I think Dr. Ramakrishna very well described it, how to recognize and how to seek medical attention. So what is plaque? It's just a buildup of cholesterol different blood cells, calcium, and other substances in the wall of the arteries. And the test to diagnose is EKG routine, echocardiogram, treadmill stress test, nuclear test, calcium score, and CT angio of the heart, and finally heart catheterization. So when you score, having a 0 calcium score doesn't mean that you don't have any clogged arteries, but it's extremely helpful even then. 0 means this is the only score in life you want to score 0, means normal. 1 to 100 means mild plaque burden. 100 to 300 is moderate. About 300 is severe. And you'll be surprised how many times I see patients completely healthy. And I do a calcium score on them, there's 400, 500, 1,000. And then I end up doing a stress test. Just because you have a calcium score above 400 doesn't mean that you're going to have significant blockage. So the next step would be to do a stress test to see if the plaque is scattered all over, not causing a major blockage, or it's causing enough blockage. The blockage has to be, in general, 70% or above to show up on the test or to cause symptoms or for us to go intervene. Until then, it's just medical management. Then CT angiography of the heart, it's already been alluded to, and finally heart catheterization for more definitive diagnosis and treatment. So this simple treadmill stressor, this is how it's done. We can do a PET CT or a nuclear stress test. So basically, so a lot of times people don't realize when we do a stress test, we are not actually looking at the arteries. We're looking at the EKG changes on the treadmill, or if you're taking nuclear or PET pictures to see the blood flow at the cellular level. This is with the stress, with rest, and you can see this is normal. Exercise, rest, you see there's a blockage. That's how the doctors can tell, there's possibly a blockage, and that you need the next step, which is heart catheterization, depending on the severity of the blockage location and all that. So the stress test, 10% chance the stress test could miss the problem. And there's a 10% chance the test could be not accurate, meaning it's saying there's something wrong, may not be. But there's some limitations like any other test. So this is a CAT scan, it's already been alluded to look at the arteries and also get a calcium score. So what are the treatment? Of course, the important first thing is medications to control all the risk factors. We'll go over that later. And then balloon angioplasty, balloon lithotripsy, where you use, within the balloon, use ultrasound energy to break up the hard block in a calcific block. And then laser atherectomy, where you either vaporize the blockage and put a stent or clean up the artery and put a stent when needed. Mostly this applies more so to the peripheral arteries rather than the heart, but sometimes you do. And then these days, most of it is medicated stent and medicated balloon. Pretty much everybody gets a medicated stent these days. And then, of course, bypass surgery when stent is not an option. And this is how bypass works. There's a blockage, and then you take a piece of vein from your leg and then hook it up from the aorta to the beyond the blockage. So blood can't get through this blockage, go through the vein. And then the other graft we mostly use is the mammary graft, which is the artery present within the chest wall. You free it up and hook it up there. This almost lasts forever, whereas the vein grafts, 50% may close within 10 to 15 years. But this pretty much is good forever. And just having a bypass surgery, having a stent doesn't mean that you're not going to have blockages in future. Or just because you had a calcium score of 100, your doctor said, hey, mild plaque buildup, no worries at this point, yes. But as the coronary artery disease inevitably is a progressive disease. It's a lifelong thing. It may take me 2 years to get another blockage. Somebody may take 10 years to get another blockage, depending on the number of risk factors they have, how well the risk factors are controlled, and their lifestyle, etc. And this is how a stent works, where it's collapsed on a balloon. You take it to the blockage and put a stent to open up the artery. And this is how a balloon works, where you don't put a stent. It could be a medicated balloon these days. This is how a heart catheterization is done, lying on the table, patient and doctor. Where we go from the groin, in these days, mostly from the arm, all the way to the heart, we inject dye. As the dye goes through the arteries, we take a picture and see where the blockages are. And this is one of my patients came in, who had blocked arteries. We open it up. So before and after the stent, you could see it, stent there, stent there. And this is somebody who came with a massive heart attack, and then after we put a stent. So Dr. Ramakrishna Garu, just part of the history. This was years ago. When I was chief of cardiology, I introduced the STEMI program after Cindy Grimes and all at Beaumont, William Beaumont in Detroit data. So at that time, a lot of cardiologists opposed me. Why are you doing this? Creating a STEMI program and creating all this. And I stick to my guns. And so we know now, since then, we had the STEMI program.
Oh, that's good.
Yeah. So next is cerebrovascular disease. Because in those days, we just used to use streptokinase. And even before that, we didn't, nothing much really, just bed rest of 1 week in the ICU, that kind of stuff, before there was PCI. What is cerebrovascular disease? It's a lack of blood flow to the arteries in the brain. Could be in the carotid arteries where it could break loose, go to the brain, or some blood clot coming from the heart go to the brain, or a blockage within the arteries to the brain. So what are the symptoms? So sudden numbness or weakness on one side of the body, either the face, the arm, leg, or whole one side, or sudden onset confusion, trouble speaking or understanding, or sudden trouble seeing in one or both eyes, or trouble walking, or dizziness, or loss of coordination, like you walk like a drunken man, things like that, or sudden severe headache with no known cause. So when these happen, it's an emergency, you just call 911. And test to diagnose carotid ultrasound, CAT scan of the brain, which you may have heard, MRI, and then CAT scan, CT or MR angiography of the brain and neck, to diagnose these conditions. And what is PAD, peripheral artery disease? Occurs when the arteries in the legs become narrowed or clogged with a plaque. And that can result in decreased blood flow and can pain or discomfort or fatigue in the leg when you walk certain predictable distance, and you stop, you get better. So it doesn't have to be pain, it could be just a fatigue. And then the extreme form of PAD is critical limb ischemia, where there's not enough blood going to the leg to keep it alive. And this can result in amputation if not treated urgently. So these are the symptoms I just mentioned. Fatigue or discomfort in the leg after walking and relief after standing still for 5 minutes or longer. And any changes in the skin color or temperature, cold feet, or any type of non-healing wounds in the feet or legs. Or if you're having other symptoms like pain, numbness, tingling, burning, feeling cold in the leg, and worse with activity, like walking. So why is it important to know PAD? Because 80% of people with PAD are never diagnosed, because a lot of times their symptoms are very atypical. Only 2.5 million out of 12 million are diagnosed, and only a small percentage get effective treatment. These days, of course, this has gotten much better, though, but it's an older data. So why is PAD important? Because this has a higher mortality than lung cancer, colon cancer, than breast cancer. Lung and colon being higher than that. And who will get PAD? These are the same people who are at risk for having heart attacks and strokes. Age above 50, diabetes, history of smoking, blood pressure, history of heart disease, obesity, high cholesterol, sedentary lifestyle, and more importantly, genetic factor. For all these three conditions, genetic factor is extremely important. If you have a family history where men below 55, women below 65 have a history of stroke, heart attack, or clogged arteries anywhere, you want to make sure that you get tested with all the blood tests and other things Dr. Ramakrishna mentioned. Because like I always say, if you have good genes, even God cannot touch you. But if you have bad genes, even God cannot help you. And having said that, especially South Asian descent like us, we are 5 to 6 times higher chance of having heart disease than other ethnic groups. And also, in our ethnic group, we tend to have smaller arteries and tend to have more multiple blockages or more diffuse disease compared to the other ethnic groups. So 1 out of 3 people with diabetes have PAD. 1 out of 7 diabetics develop some type of ulcer in the foot. And if they get untreated, they can lead to amputations. And the risk of leg amputation is 40 times greater for a diabetic than a non-diabetic. So diabetics should get their not only heart tested, they should also get tested for the circulation in the legs and maybe even carotid arteries. So this is some of the consequences of poor circulation if you don't seek medical attention, and untimely treatment versus timely treatment versus untimely treatment. These are some of the tests one could do: arterial Doppler, plasmography, CT angio, and diagnostic angio to diagnose the PAD, peripheral artery disease. And this is how the arterial Doppler study, non-invasive test, is done to diagnose PAD. And you have treatment options. Most importantly, I think for all of these conditions, walking therapy is very important to increase the blood flow to circulation to the legs and overall health. Controlling risk factors, medication, and then they have option of bypass surgery, and most of the time these days, peripheral intervention. In extreme cases, amputation. For peripheral intervention, you have balloon angioplasty, medicated balloon, stents, medicated balloon, or atherectomy where you take out the plaque. And what techniques to use? Well, the plumber knows the best which tool to use. We have so many tools at our disposal. It's best for the plumber to pick which one is needed in a given particular situation. And this is how a balloon works, just a cartoon representation. This is how a stent works. Stent is deployed. So just examples of some of my patients. This was actually a 40-year-old female smoker. Came in with pain in the hip and lower extremity on walking certain distance. So it says blockage in the aorta, in the belly, and then in the pelvis after we put the stents. This is a covered stent. Most of the stents are just a simple slotted tube stent. This is a covered stent we use in some specific circumstances. Like in this patient, aneurysm, old stent before, and then developed aneurysm. Somebody else put the stent before, and aneurysm and blockages. And then after I put a covered stent, you can tell the difference before and after. This is the lower thigh level. And this is a device to shave off the blockage, collect the blockage, and take it out. There are different kinds of techniques. Somebody with a clogged stent, we open it up with that kind of device. This is how a plaque buildup in a stent looks like. Because in the disease stage with medicated stent, only 10% or less plug up with scar tissue like this. If they don't plug up within, for the heart, within 6 months, they're unlikely that the stent plug up. They're good for 90% chance they're good forever. But that's for the heart stents are concerned. In the leg, maybe 50%. With the medicated stent these days, it's a little bit better. But this is what we took out and opened up this. And this is the native artery being blocked. This is how native plaque looks like, as opposed to stent plugging up with scar tissue. This is the thigh. This is behind the knee. This is a technique we used to use in old days where you cut it and at the same time suck the stalk clot before and after at the knee level. Other devices where you use a rotor-rooter to pulverize the plaque, it goes downstream into microparticles before and after the opening. And, somebody comes in with symptoms and you open up the artery in a timely fashion before and after. So I think in these extreme situations, I think timely action is very important. Same thing here, blocked artery and after. Yeah, somebody comes in like this and, they get treated and you get good results like that. Otherwise, they could lose the limb. Somebody blocked artery completely in the thigh below the groin level, took out the plaque, and this is what it is. This is again blocked artery before and after. Anyway, so these are the major risk factors which we alluded to already. Genetic factor, in my opinion, is very important. So if you have a family history, so please get it checked for all the blood tests and routine testing. Smoking is big. Diabetes, overweight, cholesterol imbalance, high blood pressure, sedentary lifestyle. Again, it's a big thing, especially with us, and most of us in software, get so busy and stressed out, and and your lifestyle is sedentary, you don't have much time. So it's very important that you make time for yourself. Chronic stress also adds to the problem big way. And excess alcohol intake, yes. And this is sometimes, a lot of times doctors don't ask this, but there's some data to say gum disease can be a big risk factor. So make sure that you go to your dentist regularly and get your teeth cleaned. So chronic stress is really important. It drives the heart by overloading your nervous system, and it triggers release of stress hormones like cortisol, adrenaline, causes the spike in your blood pressure, increase the inflammation of the arteries, damage the artery wall, and can worsen your health. And then, of course, genetic, we talked about, that can cause cholesterol disorder and other combination of other things, including blood pressure, diabetes, inflammation. Genetics can contribute in a big way. And so that's why I tell my patients, get a good pair of jeans, this time get a brand name. It's a joke. So high blood pressure, again, very important. These are some risk factors. 50 million Americans have it. 25% don't know, a quarter of them don't know they have it even. It's a silent killer. It increases the workload on the heart, causes arterial damage, enlarged heart, causes heart disease, stroke, kidney failure, you name it. And know your numbers, the cholesterol, your bad cholesterol, the LDL, sorry, this is total cholesterol. Total cholesterol should be normal below 200, LDL below 130, HDL above 60. Whereas in Indians, I think it should be better than below 100 in our case. But if you have a diabetes or known plaque buildup anywhere, it could be PAD or CAD, then your goal should be keep the LDL below 70, even below 50, even 50 better. Triglycerides below 135. And this can be easily accomplished with diet, exercise, and medication these days. And your blood pressure, know your numbers. 90 to 120 or 60 to 80 is your normal, but your goal is to keep your average blood pressure below 130 or 80. And then fasting blood sugars, normal being below 110. And know your hemoglobin A1C, because diabetes is very common in our ethnic group. So get it tested. Hemoglobin A1C reflects average blood sugar or 2 to 3 months. Normal is below 5.7, pre-diabetic, and diabetes. If you're on medication for diabetes, the goal is to keep your A1C below 7. And so lifestyle changes is very important. Maintain normal BMI. Moderate exercise 30 minutes, 5 days a week, 6,000 to 8,000 steps a day. Stand or walk every hour for 2 to 3 minutes. In sedentary, where people have sedentary jobs, I insist that every hour they get up and walk for a few minutes. Everything they do throughout the day counts. Every opportunity you get, you stand. Every opportunity you get, you walk. So basically, I tell them, the more you walk, the more you stand, the longer you live. And the longer you live, I tell them that it's a selfish thing. Because the longer you live, the better for my practice. So please do it for my sake, if not for your sake. And then limit alcohol intake. 1 drink per 24 hours for women, 2 per men. First of all, don't drink if you don't enjoy it. If you enjoy it, not more than this. And then quit smoking if you're a smoker. And then, of course, heart-healthy diet is extremely important. Colorful vegetables and fruits, green leafy stuff, berries, and whole grains. It's important. Quinoa, brown rice, whole wheat. Then lean proteins. So red meat, keep it to minimum. A lot of fish, especially salmon, is good. White meat is good. Take out the skin, of course, if it's white meat, and maybe breast meat is better than leg meat. And healthy fats, use non-tropical liquid oils, olive oil, avocado, they are good, instead of butter or other solid cooking fats. And limit your sodium. And then limit red meat and fried food and full fat dairy, and avoid anything with partially hydrogenated oils. And then added sugar, cut out sugary beverages, sodas, pastries, candy, keep it to minimum. Here and there you can have,
Dr. Karan Reddy garu, can you go back to the slide, please?
Sorry, go ahead.
I think here, a lot of people says that one, why you drink? They say, my doctor advised me to drink.
That's an old thing. But now we have learned that alcohol is not good.
I think we can put quit smoking is correct word. Quit alcohol intake also.
Yeah, I could say it, but when you stick to this, that's true. It's hard to limit yourself sometimes. But if you stick to this, there's no data to show that it's harmful, but we know it's not helpful. In old days, we used to say, this much drinking is good for your heart. But now we know it's not. But at least we know it's not harmful.
Okay. Thank you.
And heart disease in women, 1 in 2 women die of heart disease. 1 in 2 women die of breast cancer. Sorry, this is not 1 in 25 women. I got it mistake. 1 in 20 women die of heart disease. No, sorry. 1 in 20 women, No, what did I get? Yes. The heart disease what I'm trying to say is that heart disease I got a typo here, is much, much more common than breast cancer. So keep that in. 1 in 20 women die of breast cancer. There's 1 in 2 women can die of heart disease. And after menopause, women lose the protection from estrogen, and they tend to develop heart disease at later years because of that. And the most important thing is women tend to have atypical symptoms that could be missed. Often the symptom could be subtle or even be mistaken for stress or flu or acid reflux. And while the chest pain is a common symptom for everybody, and when I say pain, it's not pain. It could be discomfort, heaviness, tightness. So keep that in mind. And women frequently experience atypical symptoms like profound fatigue, shortness of breath, jaw or back pain, nausea, without ever having to clutch their chest. So for this reason, the heart disease women can be missed. And then, of course, yoga and mindfulness and adequate sleep is very important. Mindfulness, yoga, breathing lowers the blood pressure, reduces the stress hormones, improving heart rate variability, because yoga is really good for heart. And mindfulness techniques also. And, start small and you can slowly build it up. And rest is very important. Aim for 7 to 9 hours of quality sleep. A lot of you guys are under a lot of stress, deadline, work-related stress. So I think no job is important than your health. If you don't have health, then you don't have a job or you don't have a life. So it's extremely important because we get carried away. It's too mechanical in this day and age. So it's very important, at least for your loved one's sake, pay attention to your health and rest. Some of the yoga techniques one could follow. Probably you can find all that online also, how this is very helpful in controlling blood pressure and also helpful for your heart. And then mindfulness techniques also, you'll probably find it online. These are also very helpful in relaxing your body and also decreasing the stress. And this will help both in terms of heart disease and blood pressure control. Very important. And these are some natural techniques how to control your blood pressure. If medicines are good, they work, but I think I insist on every patient. I give a lot of patient education material, every patient. Because the more educated the patient is, the better for me also. Because I always tell them it's a team effort. Both of us have to be involved in your care, So some of these techniques of controlling the blood pressure, you do it for 2 minutes, 4 times daily, just 8 minutes, easy to do. It could be a wall squat, it could be a plank or hand grip technique to control your blood pressure. And some of the yoga poses to reduce your blood pressure. Again, you'll see it online. Well, I think I took too much time. I'm going to probably pause here and maybe Dr. Ramakrishna Garu can take over and answer your questions and things like that.
Thank you so much, Dr. Karan Reddy Garu. You explained A to Z. So thank you so much. We really appreciate, your insight and your experience. And right now, I think we can take question answers. I think most of them, Ramakrishna Garu already in the chat, he covered it, most of them. So yeah, Ramakrishna Garu, you see all of these. Can you please brief all of them in a little bit?
Let me summarize.
Yeah.
As Dr. Reddy Garu presented, he basically explained what all options are available to help you guys if you're in trouble. No question. There is help. But I want you to recognize where you are. The question all of us have is, do you have it? Do you have a problem right now? Is for you to recognize yourself. Take a walk, think about it on your own. Where are you? What is your condition? What has changed in you? How were you 4 years ago? How are you today? Okay. Number one, I feel great. Okay. Congratulations. You're healthier. Go see your doctor at least once a year, no matter what. You're going to get your car service twice a year, get yourself serviced once a year, get an EKG, get your doctor to get some blood tests done. Maybe he will order an extra test. We talked about all the tests available. Get them done. I told you that as a South Asian, Indians especially, with our chemical-laden diet we had in India, the pollution we faced, we are here in US in a different environments. Thankfully, Florida is like India, but in other states where you live, you're you're prone. Our habits have changed here. We are more animal diet right now here. I'm not saying that is wrong or right, but more animal fat getting into your body. Your changed body method. Your genes may not protect you, so get tested. Blood test, CTA. Somebody mentioned in the chat. I'm going to summarize the chat questions. They're great questions. Lifeline screening. I actually support it. Lifeline screening is a tool for people with or without insurance, which screens your heart. They take a quick heart function check. They check your carotid arteries, do an EKG, give you a good idea where you are standing. They also do a calcium score. Then, next important question, family history. Do you have problems in your family? That means you need to get tested. Get tested, know where you are, like just getting your car checked. You'll be glad to know that everything is good. No, something is wrong. There are so many doctors out there who can do outstanding work to get you better. I mean, Dr. Reddy did so many problems fixing all the time, starting with a heart attack or fixing the leg. I do all that, but we don't want you to be there. We don't want you to end up on the hospital table needing emergency procedures or something to fix. I want you to recognize them early, fix them. Medicines, everybody asks few questions. Aspirin, good question. You have no risk factors, there's no indication of aspirin. If you do have risk factors, diabetes, blood pressure, strong family history of heart disease, or you have heart disease, you should get aspirin. Then comes cholesterol screening. The good old day of doing a basic cholesterol panel, please guys, don't do it. Ask your doctor to do an advanced lipid panel, which will identify small particles, lower particles. It will also identify other risk factors, your inflammation. Your inflammation need to be tested. Your inflammatory marker should be normal. That means inflammation will quietly damage. It's like a milk boil. You've seen milk boiling over the pot. The same way, inflammation will slowly bring it. I don't want to deal with the spilling milk after the boil. I want you to recognize the milk boil early by checking your inflammation. There's so many markers to get tested. And there are treatments available for that. And then most important, family history. If you have family history, there's no reason for you to sit there waiting for symptoms to come before you get tested. Wake up, just go get tested. That's my kind of summary. Go ahead with your questions, guys. Thank you.
Thank you, Ramakrishna Garu. So can you a little bit, explain what happens? People say that when somebody died with heart attack, somebody died with cardiac arrest, and
Simple.
between these three, stroke. So can you explain what happens exactly between these three?
Two different things. Heart attack is the blocked artery causing you acute pain. You're sweating, pain is not going away. You have time. You have at least an hour to 3 hours before this gets worse. You have time to reach out for help.
Means it is a blockage. It is a
It's a
blockage to the
artery.
heart.
Blockage doesn't happen like that.
Yeah.
Blockage happens like a milk boil. Slowly it
Yeah.
starts shutting, it starts breaking. It causes unusual pain. You want to sit there and breathe and you want it to go away. It will not. It will get worse. As it starts worsening, you're going to start feeling sweaty. You're going to start feeling dizzy. Recognize it. Once that is happening, stop what you're doing, sit down, call 911 or call your family member, call 911. I need to go to the hospital. If you're worried about emergency room and all this mayhem, just go to the nearest urgent care. The urgent care is all over Orlando. Just go to an urgent care. They will take care of it. They will protect you. They know all the CPR, $100. Who cares? Pay the $100. They'll do an EKG. They will take care of you. God forbid, if you really have it, they will arrange emergency transfer to the right hospital for you to be taken care, whatever the condition. Number one. Number two, your sudden death. You're somebody collapsing in front of you, Srinigaru, what you're saying is that is sudden cardiac death. That collapse will happen if you didn't recognize, as I mentioned, you didn't recognize this heart attack slowly getting worse, that blocked artery, no blood flow to the heart starts flickering, arrhythmia, No blood flow to the brain, you collapse. Once you collapse, you have no control. No control.
So
You have
is
no
that
idea where
one
you are.
stops the heart pumping?
Yes, it
Okay.
stops the heart from pumping. When the arrhythmia comes in, the heart doesn't squeeze at all, it goes still. When there is no blood coming out of the heart, there is no oxygen to the brain. Even that, we have seen on the table, when the heart goes still, you still have about 10 seconds before entire screen comes shutting down on you. If you have a phone, it takes 2 seconds to call 911. Or in some phones, if you set up emergency call, all you got to do is drop the phone, and your Siri or Siri in Apple phone and other options will automatically ask you and say, "Do you want me to call 911?" And you say yes. Right? You can still get protected. If you need time, in sudden death, there is no time. If it still comes, you're in your garden, you have no phone on you, you never got tested, and you suddenly collapse in happening, you're very unfortunate. It's truly unfortunate. Out of the 4 deaths we know in Orlando, I know one is definitely unfortunate. When I talk to the family members or through their friends, 2 of them definitely had some symptoms. One of them had definite risk factors. It's unfortunate they didn't recognize it.
Recognize.
And I don't want any of you, look, I'm seeing 100 people on the screen. All of you think about yourself, then you think about your family members and what they're doing. Get tested. In this day and age, you don't need no insurance, you don't need too much money to get tested. You can Google Lifeline screening, you can Google healthlabs.com, you can get tested. You don't need a doctor, or you can find a doctor. You don't have insurance, pay them cash. You have insurance, still good. Go to your doctor, tell them to do all these. Get to know where you are. You're good, still good. Still, there are few people who are absolutely healthy who can still have this normal blood vessels. That's the next question.
In Ramakrishna
Yes.
Garu, in
Yes,
these
sir.
4 cases, five cases, out of 5 cases, if you can see that, 3 cases, they are not doing the regular annual checkups. They fear that, they may see some more complicated blockades, those things. That's why they are postponing. And as you said that, the screening is the first thing to prevent these, right?
Absolutely, sir. One message, lifeline screening, I think some of them are free. One message, extended blood panel testing, not just simple lipid profile. Look at your risk factors beyond a lipid profile. I think it's a dumb idea to smoke. All of us agree, right? Any question? Anybody smoking in the group here, or your family members are smoking? Guys, stop. Alcohol, there's no data to say it protects you. Alcohol may reduce your stress levels a bit, and indirectly it's covering you there. But first of all, why are you getting stressed that far?
Yeah.
Stop. Why bring the stress on? What are you trying to achieve? You achieved a lot. That's good. Take care of yourself before you take care of your family members. Making money for the family members should be your goal, but make money to yourself too. Spend some on you, relax, take a break, ease up, take a nice little walks, and live healthier. Now, I'm going to come to the third aspect of as humidity. People mentioned, oh, we are living in Florida, we have humidity, we have all this, we have a lot of hydration breaks, we need to hydrate ourselves. Look, is that a doubt? It's common sense, right? You're out working in the garden, it's too humid, having a water bottle nearby, it's common sense, no question about it. Nobody died out of drinking little excess. I mean, there's a different question. You can't drink 4 liters of water in one shot, that can give you problems. But drinking little excess water didn't harm anybody. Humidity, your work ethic, you're sweating out there, having some hydration is important. Hydration breaks for athletes, somebody is putting a question, is important is because if you're too dehydrated, your heart is beating dry, there's not enough blood for it to pump. You're not getting enough blood, you're going to get dizzy, but you're not going to die. You're going to collapse. I mean, you're going to wake up because you collapsed, you stop doing what you're doing, the heart slows down, it's able to pump enough oxygen. I'm using intentionally the word oxygen to the brain rather than blood, so that you understand. Somebody mentioned a very good question, rice and carbs equal to smoking in Indians. Very good question. I would rather say carbohydrates are the bane of modern society. Indirectly, sugars are the bane of modern society. It's important we need some carbohydrates. Our bodies have changed. We don't work like we worked in the past. Like we go out, we need that heavy carb load so that we can go out and work like serious manual labor. We don't do that. So you got reducing carb for all professionals, reducing carbohydrates to the lowest needed is important. Your biryani is great. Make sure that has good ingredients in it. If you eat a biryani every day, I'm pretty sure your cholesterol will be out of the world.
Ramakrishna
Yeah.
garu, it is
Sure.
not only those things, especially if you see, because I don't know, but I wanted to point out at this time, we do all the parties, okay? Parties goes beyond the 9 o'clock, 8 to 9, 9 after that we eat a heavy dinner. That kind of lifestyle also contributing some factors.
So two-edged sword here, sir. Two-edged sword. Think of it. I want you all to go meet your friends, relax. It reduces your stress levels. Extremely important.
Yeah.
You want to have a little drink because you are habited to it, you like it. I'm okay with it. But you need to know your limits. You need to know what's beyond. Now, food. You see a lot of good food. We all see buffet. Because it's free, you want to eat more? You shouldn't. You should recognize what is good for you. It all comes down to self reflection about what is good for you. But if you're going to race yourself like a NASCAR on the circuit, super fast all the time, you know you're going to break down. It's just a question of time. So you have to recognize that. That's unfortunately excess food, late night, you ate in full, you have diabetes, you have high blood pressure, you're going into the bed after a heavy meal, you had a drink. What do you think is going to happen to the body? Something
So
wrong, right?
they think that I'm taking pills already. They are thinking that those pills will save them.
No, they don't. Pills are an insurance. Insurance doesn't save you.
Yeah.
Hospitals does, right? You're taking pills just to reduce your risk. It's not going to remove it. You're saying I have a fire extinguisher, so I'm going to put my house on fire? No,
The same thing.
no, right? You're not going to put your house on fire because you have a fire extinguisher. It's not going to stop. Simple common sense there, sir. No question.
Here, that's
If
what.
I
Yeah.
may say something about carbs, remember our genes are not made to process carbs. Originally, we were hunters and gatherers. We're mostly having protein and other natural stuff right off the plants. And so the harvesting and grain harvesting came later on, like 15,000 years ago, whatever. So that's one thing. Our genes are not adapted yet. And also, if you look at the Western community, Western like Scandinavians, they may have rich diet, but over a period of time, some reason their genes have adapted to rich diet. But for us, our standard of living has gone up both in India and here. That's one thing. Second thing is that our lifestyle has changed, become more sedentary as opposed to in our grandfather's time. And so that's why it's very important. That's why when our lifestyle changed, we are rich, our food got rich, our genes need a lot more years to adapt to it. So that's why that's the reason maybe that we tend to have much higher incidence of coronary artery disease, and that may be the reason why we have to be extra careful compared to any other community. So processed food is also one big killer. Any carbs, especially sugars and processed food, try to keep it to minimum. In this modern age, I think we unknowingly consume a lot of processed food.
That's right. Yeah, that's
Sir,
one of the biggest factor
eh,
too.
all of us are very smart. Okay, don't go to WhatsApp University. Number one,
Yeah.
don't go to WhatsApp University. There are people posting good stuff, bad stuff. Focus on yourself, where you are, what are your risks. As I mentioned, the modern day testing is a ECG or EKG, extended lipid panel testing. Somebody is summarizing there. Having an emergency medical kit with an EpiPen at home for emergencies, recognizing your family members who are at risk, taking care of them, making sure that you have their medicines and their emergency medicine. It could be as simple as inhaler, or could be like an EpiPen, and you yourself getting tested with some extended blood panel, coronary CTA. You're a South Asian, my risk of heart disease is high. I'm 50 years old. What is the gift? If you have a close friend who reached 50, trust me, even myself, I got a coronary CTA the day I hit 45. I just wanted to know where I am. I wanted to know my plaque buildup. I wanted to know my plaque buildup so that I can target goal my cholesterol. It's very important. Just being educated means nothing. You need to put yourself in their shoes, get tested. I got tested. I'm encouraging you all to get tested so that you are there for your family members. You're all at your prime ages. Anybody between 40 to 60 is at a prime age for your family. If you drop now, think of what's going to happen to them. So that's where I want you all to focus. Don't be scared. It is just a method here. You got to change. That is expected. Get tested.
Yep. Screening, lifestyle, stress management.
Yeah. So someone mentioned the sleep apnea or snoring. Yes, sleep apnea does affect the heart. It's pretty common. So if you partner notice that you're snoring, or you'd stop breathing for a few seconds while you're sleeping, or if you're having fatigue during daytime, or headaches, or you fall asleep or driving or watching a TV, those are the signs you could have sleep apnea. So simple ways to get sleep study done. These days they could do it at home, get it tested. It's then you can wear a CPAP machine, or the other corrective measures, lose weight. One other thing I should mention, pot belly is very common among our ethnic groups, and some of that has to do with the genetic makeup, and of course the genes not being adapted yet to the rich diet that we consume these days. So I think I always tell my patient it's time to deliver that baby, so please work on it. That's one more thing. And in old days, our lifespan was much less. It was only 45. You could say, in my grandparents' days, we never had heard of heart attack. Number one, we didn't have the facilities in those days. Number two, that they used to be very hardworking out in the field, and they were not obese. And number three, they didn't live long enough because they used to die from infectious diseases. But now that we live long enough, that we are noticing more and more these diseases.
And just I'm going to add on, obesity fortunately is now also a controllable monster. Now that we have GLPs available, you'll be surprised. I mean, I don't want everybody to get a GLP. There's no reason. If your cholesterol numbers are not getting controlled with your diet, with your simple medications and things like that, now you even have GLP. GLP is nothing but your Mounjaros, Zepbounds. They're all available now. It's in current day and age, there are medicines available. In current day and age, there are doctors who are able to help you. The one thing which is not going to help you is yourself, unless you motivate yourself to change the way you're living. As Srinivas mentioned, lifestyle, way of living. I'm going to add that word, the way you're living, your lifestyle, getting tested, being there for your family, having a backup plan. If you have sick family members with diabetes or heart disease at home, learning BLS, basic life support. I hear stories of family members doing CPRs and saving their family members. Very important. Things which we Indians ignore. These are very important. Just you get your car serviced every 6 months, get your body to get serviced every year.
I will tell my story. 2006, I got some sweating and weakness. So I went to the doctor and all these tests done. They said, you need to work on your stress. Stress is the major factor at the time. So since then, I managed my lifestyle also. No carbs, no sugar, walking. These are all the three factors made me like today, all the tests are normal. And I manage my stress also by involving in the community activities where always I feel very happy. My happy hormones are very active. So healthy lifestyle and managing your stress, these two, it won't lead you to go to the doctor also. You can know that one where you are. Exactly. These are all the cases we know. Whoever listening here, they know how to manage. They know where they are. But we are postponing the screenings. We are postponing the changing the lifestyles. Sorry, my friends, we cannot postpone the incidents. We cannot postpone the sudden incidents. So that's why it is better not to postpone any of those. Not to postpone. When you postpone that, you are putting your loved ones into risky. See, sudden of all these things happens. What happens to the families? Because of our own negligence only, it is leading to that way. Now, we hear every day, believe it or not, every day in USA, the Indian family, one member is dying with heart attack. Every day. Because our organizations helps to repatriate the bodies to India also. Throughout the country, if we take every day, one heart attack happening for our Indian community. So why? We need to be very careful because we run, as Ramakrishna Saru said, we go for oil change. We go for stock markets, reading over our bank balances, our stocks, everything you do, but except reading your, health, taking care of the health. So if anything happens, what happens to our family, our parents, our loved ones? So this is the first thing what we need to take care before you check your bank balance, your stocks, your everything, luxury homes or every luxury cars. This is the first thing. Please make everybody, it's a priority task to see your doctor and make sure that certified, then only you start whatever the habits what you are doing right now. Otherwise, it is going to lead to the incidents. Thank you, Dr. Karan Reddy Garu and Ramakrishna Garu. Your valuable insight is really, really helped the community. Please go ahead.
Yeah, I
Now,
think
remember,
the proof, if I may
we
say
are
something.
just like you all. Sir, I just want all of them to understand. We are doctors. We are just like you all. We are educated. We do the same testing. I did the same testing. As Srinivas said, I have my own story. I got tested at 40, 45. I'm going to get tested again at 50. Yes, it's a balance, guys. We have to focus. We got to change. Medicines, as I said, there's so many options. You got to bring a change. Srinivas is your best example. Control your stress, get tested, get things under control. You are there. There's so many uncontrollables. At least these are controllable.
Yeah, I think the proof is in the pudding. Srinivas Garu, I think you're the best example.
I can say that.
Yeah, I thought something went wrong. You forgot to age. So I see now why you look 10 years younger.
Hi guys.
One could not say I'm too busy, I'm a lot of stress, this and that. I think you're a perfect example. You're able to juggle 10 balls at the same time and still look 10 years
Yeah, because
younger.
we know each other since 25 years here in Orlando,
Yeah.
Yeah. You see me.
Good job. Yeah. You're a good example.
Karan,
also,
it's not all Srini, and he gets 20% credit. The 80% goes to his better half.
Oh
yeah. I think
whoever saying that one, that's 100%. I will give.
No, I was hoping Srinivas will be honest and bring it up, so I didn't bring it up.
Yeah, that was Prasad, Srini. I will not get away with you taking.
Oh yeah. You are right.
Yeah, and and also I want to take the opportunity to thank Srinivas and the rest of his group to all the community service you guys doing. I think it's simply amazing.
Yep. This is all the community awareness program, keep community healthy. And also because of these things happening, we are forgetting the preparedness for these emergencies also. Actually, in the last 2-3 cases, families are like clueless. What happened? We don't know. What happened to their life? Is there life insurance is there? Is there will is there? Where the bank accounts? All these things are messy actually when these sudden of all incidents happens. And also, first thing first, as a doctor said, you need to do yourself, 100% to, live healthy. But if anything, sudden of all, because of the family history and all those things, sudden of all things happens, but we are not ready also, for the family, for the loved ones. That is also very important thing. We'll go to the next one. Ramakrishna Garu, for the community, if you want to give a one-line message, what you would give?
Live better, get tested, focus on yourself and focus on your family. Have a plan.
Thank you, sir. Dr. Karan Reddy Garu.
Yeah, so basically stay happy, stay healthy, and spend time with your family and friends. And remember that if 90 once the basic needs are met, the 90% of the happiness comes from within. So keep that in mind. Happiness is also good for health.
Thank you. Thank you, Karan Reddy Garu. Thank you. You both generously, sharing your time, expertise, and decades of experience with our community. Your insights are helpful.
One more last thing I want to mention.
Yes, sir.
For the screening test that Dr. Ramakrishna had mentioned, life imaging is in Orlando, around ORMC area. They do free testing, what he mentioned, screening for the peripheral artery disease, doing calcium score and checking your carotids. A simple scanning test done free, actually. If not, at the most, it may cost you $100. Yeah. But it's worth it. So keep that in mind.
Thank you. Thank you, sir. Thank you. Thank you so much, both of you. But right now, I think the preparedness also for this situations, emergency situations also are very important, but we are not going to take much time on that one to give. So I would like to invite some of our community, people to take, couple of minutes to that one. First, I would like to invite Mr. Chandrasekhar IL Raju. Please, just a few minutes, give your insights with your experience.
Can I share my screen? Thanks, Srinigaru.
Yes, please. Wait a minute.
See my screen?
Yeah, wait a minute. I have to give you the permission. Yeah, I think you can see, I think, make a co-host. Yeah.
You're able to see my screen, right?
Yes.
Okay. So, first of all, thank you, Srinigaru, and all the doctors who gave their knowledge. I know you both are very busy. Dr. Karan Garu, we visited you and we have some emergency at some time back, few years back. You are the lifesaver for one of our, my wife, basically, not one of my wife, basically. So thank you for that. I don't take much time. For today's education it's just ask a simple question, like if an emergency happens, so is our family emotionally, practically, and financially ready for the next 24 hours? So it's an act of love. It's not a scary thing. It's basically act of a love. And what matters most during an emergency? Number one, the time. So who calls 911? One of the recent incidents that happened is when the husband is not feeling well, wife is calling the neighbors at in the middle of the night rather than 911. If she would have called 911, the life would have been saved. So this is the primary education. We are all very educated engineers and doctors living here, but this is the primary thing that needs to happen, right? So information, current medications, doctor names, and all those things. Communication, who updates spouse, children, parents, and access. Can somebody quickly find insurance cards, ID passwords? And all these 5 things are continuity. If recovery takes weeks and months, how will income, bills, school, and home duties continue? So these are the 5 basic things that we need to keep in mind. And the third thing is 3 important questions that needs to be asked at home and discussed at home. If I'm the patient, who knows what to do first? So it can be 911, it can be medicines, or as Dr. Ramakrishna mentioned, like the basic kit. Do we have that? And if I cannot speak, who can speak for me? Do I have the legal documents in place? And health preferences, trusted contacts. And the third question is, if I cannot work for some time, what protects my family? This is the most important thing that we need to think about. We always, our community will be always in a trance situation, like nothing will happen to me. But from the last 2 years, we lost 10 people almost. 10 people in Orlando. I'm not talking about anywhere else, in Orlando. And 2 of them are very close friends of mine, family friends. So as Ramakrishna Garu mentioned, the goal is not fear. The goal is love, dignity, and our family should not go to GoFundMe. Why do we? We are sitting in the USA, and our family, if some small emergency comes, do I need our family go to GoFundMe? No, we should not be. And how I can help? I can protect in emergency documentation. I can help protection and financial strategies. I'm a licensed real estate and financial strategist. A simple family action plan tonight. Ask what would matter most if an emergency happened in our home. Okay. And in this week, take a decision. Make one emergency sheet. I can provide that sheet. I will show you in a minute. Contacts, medicines, doctors, insurance, documents. And in this month, review protection. Do you have a will? Do you have a trust? Do you know about probate? Educate yourself about probate. Probate is going to kill you. The spouse, access to key accounts. Do we have the beneficiaries in every account? If you don't have the beneficiary, it goes to probate. As simple as that. And healthy hearts, prepared families, and stronger community is the key. I'd like to show one thing which I am giving to my friends and family. Community wellness and planning checklist. This is the most important document which you need to have. Okay, a practical self-assessment guide for financial, legal, health, and business readiness. If you need this document, please reach out to me. One is the financial readiness. Do you have all these things in place? Written retirement strategy in place, emergency savings covering for 3 to 6 months, life protection coverage, investments, tax strategy, education funding in place, and legal and estate preparedness. Do I have a will, power of attorney, guardianship provisions, estate documents, HIPAA authorization? One example which I would like to tell you is, if you don't have a HIPAA authorization for your major kids, doctors are not going to disclose what they are going through. You need to have that. Do we have that education? First, educating ourselves is the most important thing. India is different, US is different. Lot of laws come into the place here. Health and protection planning. Do I have active health insurance coverage reviewed? Long-term care planning, identity protection, and any healthcare costs evaluated for cost efficiency, HSA and anything like that. And real estate and asset alignment. Do we have the things in place? Is my mortgage covered? If something happens to me, how are we going to pay mortgage? And is my loans are covered? Do we have the property things in place? The main question which we need to ask is, am I educating my spouse if I am not there about what to do for the next 3 months, 6 months, 1 year, long term? And business owners, what happens if the business, if I stop doing my business? And every day in, day out, business needs to run through. If I don't go to business tomorrow, what happens? Who will take the protection strategy in place? And how the tax efficiency strategy implemented? And the last but not the least, if any of these event triggers marriage, birth of child, you need to update this plan. And most important thing is, this is the score, community wellness score. Okay. If financial readiness, you have 7 things, how many are there in place? Legal estate, you have 9 things in place, how many are there in place? So if it is below 50%, it needs an immediate attention. You need to work on it in this week or in this month. 50 to 75% moderate readiness, and 75+% you have a strong foundation. So if your score falls below 70% any category, a structure review may provide clarity and direction. So again, thanks for Srini Garu. It is very much required at this moment in our community, because we are having, I see 3 to 4 GoFundMes from Orlando, which we should not be going through if we have a little bit of proper planning.
Yes.
So,
Yes.
so thank you, Srini Garu, for your time, for giving the opportunity to share. I can share this with the community. If you need, Srini Garu, please.
Yeah, sure. I will take from you and we will put it there. Thank you so much, Chandrasekhar Garu. And we are going to do again one more on this one special session. So we will announce that one. Thank you so much for your insight on this one. And right now, again, Rajashekhar Pujari Garu. So you are also involved in this one, making prepared, for our community when these things happens. Please go over for a few minutes on this subject.
Yeah, thank you, Srini. Chandrasekhar Garu almost covered most of the information, and thank you, Karan Reddy Garu and Ramakrishna Garu, for all your insights today on a Sunday morning, taking time out and educating all of us. I have learned a lot. I mean, I have a specific question, but I think I'll reach out separately. The gum related things, also catering to the heart problems, is something that I learned newly today. And thank you so much for getting that insight. And having that dentist regular checkups is also very, very important. In addition to the other aspects that we shared. So I'll share one slide, Srini, and then add to what Chandrasekhar Garu has already shared. So my intention is to take action today, right? Just take an action today, so that you have a plan in place. So very, very simple instructions. There is nothing really complicated. Make sure these four aspects are prepared for your family. Don't go too much into the details. At least these four are available for your family at this moment, right? It will not take like hours and hours of time. First and foremost thing, have a spouse conversation 10 minutes tonight. Like, this is where our assets are, this is what we're doing, and this is what I did, right? And if there is something happening, this is what you need to do. Just a 10 to 15 minutes conversation with your spouse, because a lot of cases that Shini Garu was handling, a spouse is not having a clue on what to do next, right? And even Chandrasekhar Garu also was saying, like, they're calling the neighbors, then 911, right? So have a proper 10 to 15 minutes conversation. That's the first thing. Second thing is, have your beneficiaries updated in your what do you say, all of the accounts, right? Like including your 401ks, including bank accounts, and any account that you have beneficiaries up to date, right? Not just updating. Up to date is not you already might have updated it, but make sure it is up to date as of today. Next is term life insurance. Have a simple term life insurance. I mean, there are so many life insurance strategies out there. You might be having an insurance with your employer, but we have uncertainties on the job also. In addition to the life, we have uncertainties on the job as well. So what if something happens to your job and all of a sudden, there is an event, right? That simple coverage is also not there. Have an outside life insurance plan that will protect your family financially. It won't cost too much. If you're healthy and then you're having a healthy lifestyle, it may be 30 to $50 depending on the death benefit that you want. Next, will, right? Have a will in place. If you have younger children, minor children, making sure your guardianship is updated for your children, what to do with your assets, and what to the HIPAA authorization for your health, and who takes care of your health decisions, financial decisions. So these are four aspects, very, very simple aspects, and it will not take too much time also. Have these in place so that you're prepared for it. That's what Srinigar was saying. Like, first thing is, having precautions, measures to not get into that situation. But unfortunately, 25% of the events are happening without any symptoms. 50% of the rest are happening even with symptoms and not having a proper care. So even after that, we are prone to this kind of situation, and we need to be prepared for that uncertainty. And these four aspects will make sure your loved ones are protected, and they are having a structure in place for all of these uncertainties, right? So I'll make a call to action. have 1 hour blocked for this week. Okay, not more than that. Just 1 hour for yourself. You don't have to, schedule with anybody. Just 1 hour blocked for your calendar. Have a agenda like all these four aspects. I need to take a look at it. I need to make sure these things are in place for my family. Right? Label it as family protection review. I'll take 30 seconds, Srinigaru. Open up your phone, block your calendar. It can be iPhone, it can be a Google, whatever it is. Block that 1 hour right now, and then make sure you have those things in place. Right? If you need any help, please reach out to Chandrasekhar Garu, me, or there are a lot of professionals out there who can help, and we can definitely help with the community. Thank you, Anish Garu.
Thank you, Rajshekhar Garu, for your call for action. Thank you so much for your insight.
Since you guys mentioned spouse, I will take just a minute how important it is, especially when it comes to male patient. This is my experience. Make sure that women out there, anytime your husband is coming to see a doctor, make time to be with him, with the doctor. Because half the time, for whatever reason, the men tend to not give the total history to the doctor. And a lot of times, women catch it before men know it that they are having a problem. And it's very important. And that's why I always insist every male patient who comes to me that they should come with an adult. They cannot come on their own. Adult meaning the wife.
Thank you. Thank you, Dr. Karan Reddy Garu, for your suggestion. It's a very, very, very needed one, actually. That's and right now we have, I think Yogesh Ji, if you are here, Dr. Yogesh Ji is also a cardiologist. I think a lot of years of experience. If you want to say a few words, Dr. Yogesh Ji, please go ahead and,
Oh, hi, Srini Guru. How are you?
Good, sir.
I'm in a drive, but I attended the session very well. And both the cardiologists, esteemed cardiologists, they did an excellent job in their presentation, giving the knowledge to the community and raising a significant awareness and to be, for everyone to pay attention. And it doesn't take much time, as they mentioned. Everybody just needs one doctor visit a year on an average, maybe two, and then do all the basic testing as they recommended. And one of the things which was highlighted was that do advanced lipid profile. That's very important, which includes the LPA. Is also an important measure to do. And then follow the doctor's advice. Sometimes, as you also mentioned, that people just postpone. They get recommendation, but they postpone. So it's very important to hear the recommendation and act on it. So, and the biggest thing I think also hard for people to change is their lifestyle changes, because I think, in my opinion, I have gained also more knowledge even after I retired in the recent times, that your diet and lifestyle plays so much role in making things better for you, in addition to medication. There are some cases where you definitely need medication even to start before you make lifestyle changes. But lifestyle changes and diet particularly, and exercise, stress reduction, all those things are so important. It clearly appears that they can benefit you way more in many cases than your medications itself, especially in chronic diseases, especially in prevention purpose, and then having a good, long, healthy life. So I think certainly there can be more of such presentations in future. Definitely that would bring even more awareness and knowledge forefront. And I wish people who attended the session benefited with this, and they put into action that they may not be doing and paying attention to their health, and especially when we are younger or middle-aged, busy with career, lives, raising kids, we just postpone things. I mean, I can even say to, even as physicians, I think some of us probably, well, we are busy and taking care of patients and the family, we forget about ourselves, but, as somebody wrote, and which is very true, health is wealth, so if you're healthy, you're wealthy, in a lot of respect, not just wealth in terms of
That's
what's
true.
your bank balance,
That's true.
So I think it's very important that you put this together. Thanks to you, you've been doing a yeoman service for this community for a long, long time. So we may need to commend you for that. And in future, also, if I can contribute in any which way, along with the other cardiologists, and not to say anything in a flattering way, but all the knowledge is there, and the knowledge is in the books. But I think the experience that personally I got over 35 years of cardiology practice is extremely helpful, because the books are books, the rules are in the books, but when you live the practical life and take care of patients over a long period of time, it certainly it teaches you a lot, and no books and no guidelines can really beat the experience.
Sure. Thank you so much, Yogesh ji. I know you
Yeah,
already told that if anybody needs any advice, you are always available. You're retired. So thank you
absolutely.
so much for your time.
No
And
consultation charge.
yeah, thank you.
No
Thank you.
consultation charge. I'm always available.
Yep. Thank you so much, sir.
Yeah, thank you.
Yeah.
Srinivas Garu, can I make one last thing?
Yes, please.
Now, just as Rashekar Garu mentioned, call to action, I would request all the spouses, female spouses, to ask their the husbands like some questions, like what's happening, how is it going, instead of our community ladies are like, oh, my husband is taking care of everything. Okay, so that's one of the problems which we are seeing in the families today. So ask some questions about all these things, what we discussed today, that you are aware of that.
That's true. Thank you for your. And right now I'm going to call Mridu Sharma. For to give some insight about the preparedness for for emergency situations. Thank you. I will give permission to share your screen if you have.
Yes.
Yep. Thank you.
Okay. Thank you so much. Hello, everyone. Thank you so much, Mr. Srini, Dr. Karan Reddy, Dr. Ramakrishna, Mr. Chandrasekhar, and Mr. Rajshekhar for bringing this event together and helping educating the community, which is very, very important. So I'll just take 5 minutes. So introducing myself, I'm Ridu Sharma. I'm a financial strategist. I have helped more than 245 plus families from Florida to New Jersey, from Texas to Nevada. I'm all over the place. I and my husband is in this business full time. We 24/7, we just do this, help our community, help people, so many people whomsoever we can reach out. So I'll share my screen just a moment to give more insight on this subject. I know this is not a dinner talk. That's why we mostly avoid, but it is important. Earlier in this session only we learned that we have spoken about how to keep ourselves healthy, right? But what will happen? We all have come with two-way tickets, right? So what will happen when things change and we lose someone who is, mostly if he is the earning member of the family, then it becomes really difficult for the people who are left behind, right? So just quick question for everyone. If you didn't wake up tomorrow morning, would your family be financially secure? This is not the dinner talk, but it is very, very important to talk, to speak, to have these things in place. Would your spouse be able to pay the mortgage? Would your children still be able to go to college? Would your family have enough income to maintain their lifestyle? Most people insure their cars, homes, phones. Why? Because it is mandatory, but often neglect their greatest asset, their ability to earn income. and we put ourselves as optional. Why? Ask yourself today. So common questions I hear every time I meet people. I have assets and insurance in India, right? That is great. But if something happened to you tomorrow, could your family immediately access those assets? Would they be able to travel to India, handle paperwork, sell property, and claim benefits while dealing with emotional loss? The real question isn't whether you have assets, but it is whether your family can access them when they need it. Is it easily accessible for them? Another question that I get, I don't have enough money, right? I understand you don't have enough money, but if you don't have enough money for life insurance today, how would your family come up with $25,000 or $30,000 tomorrow for funeral expenses and immediate bills? Right? Life insurance isn't for the person who passes away. It is for the loved ones who are left behind. Who is going to take care of them? If we have money for Netflix, if we have money to go out and eat every other day, we have money to protect ourselves, to protect our family, leave some legacy for them. Thirdly, I get the question, my visa status is temporary. I understand. We all are temporary. Our life is temporary, not just the visa status, right? But your visa status may be temporary, but your life here is not. Your spouse is here, your children is here, your responsibilities are here, your dreams are here. Don't let a temporary status create a permanent financial hardship for the people you love. Right? These things are important to address, to talk, to have in place when it is needed. Lastly, I have the question, I already have insurance through my employer. That's wonderful. That's an added incentive, right? But what happens during the period? Imagine you lose your job in January, don't start your next job until May. The gap between January and May is uninsured, unprotected. If something happened during those 4 months, would your family still be protected? Employer coverage is valuable, but it is tied to your job. Your family's protection should stay with your family, not with your employer. If any of these questions apply to you, isn't it worth taking 15 minutes to review your family's financial protection plan? So why life insurance? Why we are here to protect ourselves, right? Because we got so many cases that has shaken us from within, shaken our community. That's why we have to come together. That's why Mr. Srini has to bring everyone together for this amazing session. So why life insurance? Life insurance, it helps provide income replacement. If one family loses earning member, if without life insurance, you are putting your family behind for 10 years. For 10 years, they have to struggle to come to the space that you are right now. Then they can move forward ahead. So what do we want to leave behind? Lifetime of struggle for them, or a head start so that they can live the life without you also, but in a proper way. It helps provide with mortgage protection, children's education, debt elimination, funeral expenses, legacy creation, and most importantly, heart disease, critical, chronic, terminal illnesses. If we don't have money for life insurance, what will happen if we get hospitalized? Who is going to bear the cost of medical, right? Health insurance doesn't cover everything. It won't cover your 6 month of bed rest. It won't cover mortgage protection, right? So life insurance is simply a financial safety net for the people you love. So that's all from my side. I would just request everyone, go ahead, speak to the financial professionals near you, talk to them, understand the need that your family has, that your family can be helpful with. And just lastly, I would like to address, if you fail to plan, you already plan to fail.
Thank you.
And no one would want our family to fail in this times, right? So thank you so much, everyone, for giving me chance to speak. And address this session, address the attendees. Thank you so much.
Thank you so much, Vidhu. Vidhu Joshi ji, thank you so much. And Meena ji, are you here? Meena? So if you are here, tell me. And meanwhile, I'm going to ask Sanjeev from the H1 perspective, if you want to, say, please let me know.
Hey, Srini, am I audible?
Yeah.
Yeah, I think Mridula Joshi, the last speaker, nailed it everything properly, right? See, I came to know about this life insurance or like term insurance some 4 or 5 years back when one of my friend's friend in Atlanta died in some cricket while playing cricket. So from that day onwards, I've been telling everybody to have this life insurance. So Mridula Joshi, I mean, covered most of the points which I wanted to tell. But from other perspective, right? Like just I wanted to put across in a minute. I mean, as Mridula was, I mean, everybody was telling, right? Like our life is only temporary and all. So you don't need to worry about H1 and anything others. You just need to follow your passion, whatever you want to do, like extracurricular activities. I'm talking about. I'm not talking about any work perspective or promotion, salary, bonus, and all those stuff. You just need to follow whatever is your passion, like doing some culture, extra curricular activities, plus help as many people as you can in getting job or telling whatever that will give you a lot of satisfaction. And finally, just I mean, travel with your family wherever you want to go, and forget about everything else. And one more most important thing is like we need to have our HSA card. HSA card is like wherein we will put money for our insurance related activities. Anything, whatever happens for your health, don't worry about the money. Just use your HSA card as much as possible. Think that you are paying it as a tax, that you are putting the tax and all. Yeah. That's it. I wanted to tell Srini from my end.
Thank you. Thank you so much, Sanjeev.
Yeah.
Good points.
Yeah.
So, yeah. And right now, Meena, she's going to say a few words, insight about the preparedness. Thank you.
Hello, all. This is Meena Nimagatta. I'm the founder of Smart Goal Financial Solutions, and I'm also joining my peers today in supporting the community to plan for emergencies through life insurance. And I want to be able to talk more about it during the emergency preparedness meeting, where I can give you some tips on how to get insurance quickly and in what situations you need to be more prepared than the rest of the people for getting life insurance, because certain genetic factors in the family make you more disposed to situations where you are kind of helpless. Even if you're in like 30s and 40s, you need to be well prepared than others who have better genes. So I'll be able to talk to you about those situations in the emergency preparedness meeting and give you the tips to come up with plans that will help you eventually be more prepared before any unexpected health situations hit your life. So I'll talk more about it in the next meeting. Thank you so much, Srini Garu.
Thank you, Meena Garu. Thank you so much. And we are going to conclude this today's session. But before that, CFIC is going to do every month health sessions with the different doctors, with the different specialists. Every month, this is going to happen through the CFIC, this one, and also this preparedness session. Also, we are going to conduct a very special session through CFIC in future. Please get ready for that also. And thank you so much, Dr. Karan Reddy Garu and Ramakrishna Garu, for sharing your expertise and taking time. Thank you so much for educating the community. And also, I would like to thank everyone in our community who joined us today. Your participation reflects the importance of this topic and our shared commitment to protecting the health and well-being of our families and loved ones. On behalf of the CFIC core volunteers and the team, thank you once again, all of you. Please stay healthy, stay informed, and encourage your family members and friends to prioritize their heart health. Thank you and have a wonderful day. And this recording will be uploaded to the CFIC YouTube channel. Thank you so much.
Thanks, Srini Garu, for putting
Thank you,
this
everyone.
together.
Yeah, thanks,
Thank you,
Srini Garu.
everyone.
Great meeting. We learned a lot about aspects of planning for the
Thank you, sir.
family.
Thank you, sir. Thank you. Have a good day, all of you.
Thank you.